The member for Corangamite.
Thank you, Mr Speaker. My question is to the Minister for Health and Sport. Will the Minister update the House on recent listings to the Pharmaceutical Benefits Scheme? How do these recent listings support hard-working Australian families and reduce cost of living pressures?
The Minister for Health and Sport.
Thank you very much, Mr Speaker, and I want to thank the member for Corangamite, who has long been an advocate for families of children with cystic fibrosis, along with many members of this House, including in particular the member for Forrest, and also I want to acknowledge the member for Farrer, who worked long and hard over many, many months to help families with cystic fibrosis. In that context, I particularly want to note that it was an honour and a privilege to be able to join the member for Corangamite in visiting families from Cystic Fibrosis Australia outside Parliament House last Wednesday. Whilst we were there, we were able to make the announcement that the drug Kalydeco will be listed on the Pharmaceutical Benefits Scheme. As a consequence of that, families who would otherwise have had to have paid up to $300,000 a year will be able to access life-saving drugs for children between 2 and 5 years of age. It was previously available for children over that age, but that has now been extended to children between 2 and 5 years of age inclusive. That $300,000 for families of and parents such as those of young Dash, we met those parents, is money which could never have been found. It is money which is exactly the sort of thing that a government should be doing through its healthcare system, providing for those who are least capable with the most important needs. These children's lives will be profoundly different as a result. In addition to that, this is Ovarian Cancer Month, and I have also been fortunate to be able to list the drug olaparib on the Pharmaceutical Benefits Scheme. That drug would ordinarily have cost $100,000. It will now be made available to over 230 women who face the terrible scourge of ovarian cancer. It is likely to improve the quality of their life significantly. It is likely to extend the quality of their lives by a number of years. It is not a cure at this stage, and so medical research is fundamental. Other decisions that we've been able to make in the last few weeks include drugs for lung cancer, drugs for other areas, in some cases, again, saving families $100,000 a year. So that is what comes about through careful and a sustainable combination of 4 pillars. A commitment to universal access for Medicare and pharmaceuticals, firstly. Secondly, a commitment to universal access through our hospitals. Thirdly, a focus on mental health and preventive health. And fourthly, a focus on medical research. So there is more to be done on the medical research to extend the range of outcomes and treatments which can subsequently be listed. But these drugs have been able to be listed because of the combination of medical research coupled with sensible, prudent budget management, which gives us the ability to save lives and to improve lives exactly as our health system should be doing.